Our skin is amazing, it protects us from the outside world. But sometimes bacteria can sneak in through cuts, bites, or even dry skin. This can lead to infections like erysipelas and cellulitis. These conditions might sound complicated, but don't worry, they're treatable, especially when caught early. Erysipelas and cellulitis are both bacterial skin infections. They share some similarities, but there are key differences to help us tell them apart. Understanding these differences is important for proper diagnosis and treatment. In this article, we'll break down everything you need to know about erysipelas and cellulitis in a clear and understandable way. We'll discuss their causes, symptoms, diagnosis, treatment, and prevention. Let's dive in. Erysipelas is a bacterial skin infection that affects the upper layers of the skin. It's often caused by a bacteria also known as group A strep. Remember strep throat? It's the same bacteria. Erysipelas typically appears as a red, swollen, and painful patch of skin. This patch has a distinct raised border that looks like a burn. The affected area might also feel hot and tender to the touch. Erysipelas most commonly affects the legs and face. However, it can occur anywhere on the body. It's important to remember that erysipelas can spread quickly, so early treatment is crucial. Cellulitis is another bacterial skin infection, but it goes deeper than erysipelas. It affects the deeper layers of the skin and can even spread to the underlying tissues. Cellulitis is often caused by bacteria. These bacteria can enter the skin through cuts, scrapes, insect bites, or even dry, cracked skin. Unlike erysipelas, cellulitis appears as a red, swollen area that's less defined. The borders are not raised and are harder to see. Like erysipelas, the affected area is usually painful, warm, and tender. Cellulitis can occur anywhere on the body, but it commonly affects the lower legs. It can also develop in areas with reduced lymphatic drainage, like the arms and legs. While erysipelas and cellulitis have distinct appearances, they share some common symptoms. Knowing these symptoms can help you seek medical attention promptly. Both erysipelas and cellulitis cause redness, swelling, pain, and warmth in the affected area. The skin might also feel tight and tender. In addition to these local symptoms, you might experience fever, chills, and swollen lymph nodes. These are signs that your body is fighting off the infection. If you experience any of these symptoms, it's important to see a doctor right away. Early diagnosis and treatment are crucial for preventing complications. Section 5. Erysipelas versus cellulitis, key differences. While erysipelas and cellulitis share some similarities, there are key differences that help doctors differentiate between them. Understanding these differences is essential for proper treatment. The main difference lies in the depth of the infection. Erysipelas affects the upper layers of the skin, while cellulitis goes deeper, involving the subcutaneous tissues. This difference in depth also affects their appearance. Erysipelas presents with a well-defined raised border that resembles a burn. Cellulitis, on the other hand, has a more diffuse appearance with less defined borders. The redness and swelling blend gradually with the surrounding healthy skin. Another difference lies in the onset of symptoms. Erysipelas tends to develop rapidly, while cellulitis progresses more gradually. This distinction can provide valuable clues for diagnosis. Section 6. Diagnosing erysipelas and cellulitis. Diagnosing erysipelas and cellulitis usually involves a physical exam and a review of your medical history. Your doctor will examine the affected area, looking for the characteristic features of each condition. They'll ask about your symptoms, including when they started and how they've progressed. Be sure to mention any recent cuts, scrapes, or insect bites, as these can be entry points for bacteria. In some cases, your doctor might recommend further tests to confirm the diagnosis or rule out other conditions. These tests might include blood tests to check for signs of infection, like an elevated white blood cell count, wound cultures to identify the specific bacteria causing the infection, which helps determine the most effective antibiotic, and imaging tests like ultrasound or MRI might be used to assess the extent of the infection, especially in severe cases. Section 7. Ruling out other conditions. Sometimes what looks like erysipelas or cellulitis could be another condition. Your doctor will consider these possibilities during the diagnosis. For example, deep vein thrombosis or DVT can cause leg pain, redness and swelling similar to cellulitis. However, DVT is a blood clot in a deep vein, usually in the legs. It requires different treatment than a skin infection. Another condition that can mimic cellulitis is venous stasis dermatitis. This occurs when there's poor blood flow in the legs, leading to skin changes, including redness, swelling, and even ulcers. By carefully considering your symptoms, medical history, and performing necessary tests, your doctor can accurately diagnose the cause of your skin condition and recommend the appropriate treatment. Section 8. Treatment options. Combating the infection. The good news is that both erysipelas and cellulitis are treatable, usually with antibiotics. The type of antibiotic and the duration of treatment depend on the severity of the infection and your overall health. For mild cases of erysipelas and cellulitis, oral antibiotics are usually sufficient. Your doctor might prescribe penicillin, amoxicillin, or a cephalosporin antibiotic. It's crucial to complete the entire course of antibiotics, even if your symptoms improve before you finish all the medication. For more severe infections, intravenous antibiotics might be necessary. This usually involves hospitalization so you can receive the antibiotics directly into your bloodstream. In addition to antibiotics, your doctor might recommend other measures to relieve symptoms and promote healing. These might include pain relievers like ibuprofen or acetaminophen, which can help reduce pain and inflammation. Elevating the affected area can help reduce swelling. Applying cool compresses to the affected area can help soothe pain and reduce inflammation. Section 9. Potential complications, from abscesses to sepsis. While most cases of erysipelas and cellulitis respond well to treatment, potential complications can arise, especially if the infection is left untreated. One possible complication is the formation of an abscess. An abscess is a painful collection of pus that forms within the skin. Abscesses often require drainage, which involves making a small incision to allow the pus to drain out. In rare cases, the infection can spread to the bloodstream, leading to a life-threatening condition called sepsis. Sepsis occurs when the body's response to infection damages its own tissues and organs. Signs of sepsis include fever, chills, rapid heart rate, rapid breathing, and confusion. If you experience any of these symptoms, seek immediate medical attention. Section 10. Preventing erysipelas and cellulitis. Practical tips. Preventing erysipelas and cellulitis involves reducing your risk of getting a skin infection. Following these practical tips can help keep your skin healthy and infection-free. Practice good skin hygiene. Wash your hands frequently with soap and water, especially after using the bathroom, before preparing food, and after touching any open wounds. Keep your skin clean and dry. Shower or bathe regularly, and dry your skin thoroughly, especially in areas where moisture tends to collect, like the groin, armpits, and between the toes. Moisturize dry skin. Use a gentle, fragrance-free moisturizer to prevent dry, cracked skin, which can provide entry points for bacteria. Protect your skin from cuts and scrapes. Wear protective gear like gloves when doing yard work or other activities that could injure your skin. Treat any cuts or wounds promptly. Clean the wound thoroughly with soap and water. Apply an antibiotic ointment and cover it with a clean bandage. Manage chronic conditions. If you have conditions like diabetes, peripheral artery disease, or any condition that affects your immune system, follow your doctor's recommendations for managing these conditions. Section 11. Living with recurring infections and importance of follow-up. Some people are prone to recurring episodes of erysipelas or cellulitis. This is more common in individuals with weakened immune systems, chronic skin conditions, or poor circulation. If you experience recurrent infections, it's crucial to work closely with your doctor to identify and manage any underlying conditions that might be contributing to your risk. Follow-up appointments are essential for monitoring your condition and ensuring that the infection has completely cleared. Your doctor might recommend preventive measures, such as long-term prophylactic antibiotics. Taking low-dose antibiotics regularly can help prevent future infections. Compression therapy. Wearing compression stockings can improve blood flow in the legs and reduce swelling, which can lower the risk of infection. Remember, early detection and treatment are key to preventing complications. By taking care of your skin and seeking medical attention when needed, you can stay one step ahead of these infections.